Did you know that simple everyday habits might be secretly harming your kidneys? From holding in your urine to skipping water breaks, these seemingly minor missteps could be putting your kidneys at risk without you even realizing it. Shocking, isn't it? Yet, this is a reality for many people. Stick around as we uncover the top 10 habits that could be quietly harming your kidneys and learn how to protect these vital organs before it's too late. Your kidneys, though small, play a vital role in your body. They tirelessly filter waste, balance fluids, and regulate blood pressure. However, some daily habits, often overlooked, could be compromising their health. If you're committed to preserving or enhancing your kidney health, it's essential to identify and address these potentially harmful practices. In today's video, we'll discuss the top 10 daily habits that might be quietly harming your kidneys. These aren't just minor missteps. They're habits you should change to reduce your risk of chronic kidney disease. Let's take a look at these habits. Holding in your urine. We've all experienced it, being caught up in work, stuck in traffic, or engrossed in a task, and putting off a bathroom break. But regularly holding in your urine can have more serious consequences than you might think. Ignoring the urge to urinate puts extra pressure on your bladder, potentially leading to stretching or weakening of the bladder muscles. This can result in incomplete bladder emptying and increase your risk of urinary tract infections. If these infections reach your kidneys, they could lead to severe kidney infections. Additionally, frequently holding in your urine can contribute to kidney stone formation. When you delay urination, the minerals in your urine have more time to crystallize, increasing the risk of stones. To safeguard your kidneys, make it a point to use the restroom as soon as you feel the urge, rather than holding it in. Overusing painkillers. Painkillers, particularly non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and naproxen, are commonly used to relieve aches and pains. While effective, excessive use of these medications can have detrimental effects on your kidneys. They may reduce inflammation but also decrease blood flow to the kidneys, which can impair their function over time. Regular use of painkillers can cause analgesic nephropathy, a kidney condition that may lead to chronic kidney disease. This damage is often permanent and can gradually reduce kidney function. To protect your kidneys, use painkillers only when needed. If you need them often, talk to your healthcare provider about safer options or addressing the underlying cause of your pain. Not drinking enough water. Water is essential for healthy kidney function. Your kidneys need enough water to filter waste from your blood and produce urine. Not drinking enough water forces your kidneys to work harder, leading to waste buildup. Dehydration causes concentrated urine, which can irritate the kidneys and increase the risk of kidney stones. Chronic dehydration can also gradually impair kidney function. To avoid these problems, make sure to drink plenty of water throughout the day. While your exact needs may vary depending on your activity level and climate, a good goal is to consume at least 8 glasses of water daily. Carrying a water bottle with you can help ensure you stay hydrated and support your kidney health. Consuming too much salt. Salt is a common part of most diets, but consuming it in excess can be detrimental to your kidneys. Sodium, the primary component of salt, plays a role in maintaining fluid balance, nerve function, and muscle contraction. However, too much salt forces your kidneys to work harder to filter out the excess sodium, putting strain on them and potentially leading to a decline in kidney function over time. High salt intake can cause water retention, raising blood volume and pressure. High blood pressure can damage your kidneys and worsen chronic kidney disease. It also increases the risk of kidney stones. To protect your kidneys, reduce salt by cutting down on processed and fast foods and opting for fresh fruits, vegetables, and herbs. Consuming processed foods. Processed foods are convenient and tasty, but can pose hidden risks to kidney health. They are often high in sodium, sugar, unhealthy fats, and preservatives. Excessive sodium can lead to high blood pressure, a major risk factor for kidney disease. Moreover, these foods are usually low in essential nutrients and high in additives, which can create an acidic environment in the body, putting extra strain on your kidneys. Regularly eating processed foods can lead to weight gain and obesity, raising the risk of diabetes and hypertension, which damage the kidneys. To protect your kidneys, limit processed foods and eat a diet rich in whole natural foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Cooking with fresh ingredients supports your overall health and provides essential nutrients for your kidneys. Ignoring high blood pressure, often referred to as the silent killer, high blood pressure is a major cause of kidney damage. Persistently high blood pressure puts added stress on blood vessels, including those in your kidneys, which impairs their ability to filter waste and excess fluids. Over time, this can lead to hypertensive nephropathy, a condition where the kidneys suffer progressive damage. Unchecked high blood pressure can accelerate chronic kidney disease and lead to kidney failure. To manage it effectively, follow a healthy diet, exercise regularly, reduce stress, limit alcohol, and take prescribed medication. Regularly check your blood pressure at home to monitor changes and prevent serious damage. Excessive sugar intake. Regularly consuming processed foods can cause weight gain and obesity, increasing the risk of diabetes and hypertension, which can harm the kidneys. To protect your kidneys, reduce processed foods and focus on a diet with fruits, vegetables, whole grains, lean proteins, and healthy fats. Using fresh ingredients supports overall health and provides essential nutrients for kidney health. Sugar also contributes to high blood pressure, which places additional strain on your kidneys. To safeguard your kidney health, be conscious of your sugar intake by checking food labels and reducing consumption of sugary beverages, processed snacks, and desserts. Instead, choose natural sweetness from fruits and enhance flavor with spices like cinnamon or vanilla, avoiding the need for extra sugar. Smoking. While smoking is widely recognized for its detrimental effects on the lungs and heart, it also poses significant risks to kidney health. The harmful chemicals in cigarette smoke enter your bloodstream and reach your kidneys, causing inflammation and damage to their delicate blood vessels. This impairment reduces the kidney's ability to filter blood effectively, leading to a dangerous buildup of toxins in your body. Smoking also diminishes blood flow to the kidneys, raising the risk of chronic kidney disease and kidney cancer. Quitting smoking can significantly enhance your kidney health, even if you've been a long-time smoker. There are many resources available to support you in quitting, including support groups and nicotine replacement therapies. Excessive alcohol consumption. Alcohol consumption is often seen as a way to relax or socialize, but excessive drinking can seriously affect your kidneys. Your kidneys filter toxins from your blood, including alcohol. Drinking too much forces your kidneys to work harder, leading to dehydration and increased stress on the kidneys. Chronic alcohol consumption can also damage the liver, which affects kidney function, and contribute to high blood pressure. To safeguard your kidneys, consume alcohol in moderation. No more than 1 drink per day for women and 2 drinks per day for men. If you find it challenging to stay within these limits, seek support from a healthcare professional or a support group. Neglecting diabetes management. The most crucial factor for maintaining kidney health is effectively managing diabetes. Diabetes is the leading cause of chronic kidney disease and kidney failure. Elevated blood sugar levels can damage the tiny blood vessels in your kidneys, impairing their ability to filter waste and excess fluids efficiently. Diabetic nephropathy develops slowly and can lead to severe kidney damage if not properly managed. Effective diabetes management includes regularly monitoring blood sugar levels, maintaining a balanced diet, engaging in regular exercise, and following prescribed medications. It's also crucial to manage related risk factors like high blood pressure and high cholesterol. Proactive management of diabetes can significantly reduce the risk of kidney complications and help protect your kidney health. Remember, your kidneys are vital to your body's functioning, and taking care of them is one of the best investments you can make in your long-term health. And there you have it, 10 daily habits that might be quietly harming your kidneys. From holding in your urine to neglecting diabetes management, each of these habits can lead to serious damage over time. The good news is that by recognizing these risks and making simple changes to your routine, you can significantly improve your kidney health and overall well-being. If you enjoyed this video, don't forget to hit the like button and subscribe to our channel for more tips on staying healthy and improving your well-being. We've got plenty more videos on health topics that you won't want to miss. Thanks for watching. See you in the next video.